Hi, everyone. Thanks for having me today. My name's Neva Loney, and I work with the DPHHS in the State Health Department. I do actually live here in Missoula, so it's always fun to get out of my office and be with real people and not just on screens. And so I really appreciate that. As Mackenzie mentioned, in my role, I work in our system improvement office. And so I work directly with county health departments and tribal health departments in completing these community health assessments and community health improvement plans. So sounds like a lot of acronym soup, but really at the heart of both of these plans is community involvement. So working with the local and tribal health departments, what we're finding is that they too are getting kind of lost in this process because it does seem overwhelming, but we really want to see and build collaboration within the communities. So some of the ways that we're doing that and working with the health departments is really trying to push them to think outside the box. They might have partner organizations that they've worked with before and have completed these plans, but trying to get these health departments to think about who's not at the table right now and how to include them. One of the things I feel like government is maybe not notoriously bad at, but maybe a little, is communicating our why instead of your why. And so communicating with these organizations of why should you be involved in this process and why you should participate. And the reason is because the health department is trying to put together the story of the community. And they do that by putting together the story with data. And so we collect data from various sources. And part of that data is also the community, and your voice and what you add to that story is hugely important and directs the actions of the health department for years to come. So that's kind of the first part of the process, and really trying to involve the community and helping health departments identify those key partners to involve in the process. And to be honest, it's been really hard in some communities. We send out all kinds of, invitations to stakeholder meetings and surveys and things to get people involved. And a lot of times we have very little involvement. So we're really trying to think about that message that we're sending out and really communicate it in a way of just, here is why you should participate, and here's why your voice needs to be heard, because it really does impact what the health department does moving forward. We're also looking at things in the implementation part of it. So that would be the CHIP, so the Community Health Improvement Plan is the implementation of, once the story is told and community needs have been identified, how are we going to implement that? How are we going to make communities a better place moving forward? And that's the CHIP. So within the CHIP, we try to have key priority areas with actionable objectives. And a lot of times it becomes just like this document that's sitting out there somewhere again, and like the community doesn't feel that they're a part of that. So again, trying to think of, how are we using our tools to push that message out? And so that's again why people should be involved in the process to help health departments, like it needs to be posted here. The document that you're providing is not accessible. The document that you've put together is full of data and acronyms and jargon that nobody understands unless they have a public health background. And that's not the intention. The intention is for community members to be able to look and see what their health department is. And, in Montana, every county and tribe has their own health department. And it's for community members to be able to look at those, documents or whatever the communication is and really understand the actions of the health department. So that, in a kind of nutshell, is what we do. But really taking that and trying to not make a big, huge, complicated process. There is a process, don't worry, but making it a little bit approachable. But I guess I would just encourage everybody here, in one manner or another, like if you see an email or a call to action from a health department, is we and speaking with the tribal and county health departments, they really want to hear from everybody. And unfortunately, a lot of the times it ends up just being a few voices at the table, and those voices are the ones that are being heard, and those are the voices that are being put into action. And so if you want your voice to be heard and put into action, then we need help show up at the table. I didn't really have anything prepared, but that's my little spiel, and happy to take any questions if there are any.
Okay. Why the term stakeholder? Because to me, that just seems like people with money.
Oh, wow. Um, you're, thank you. No, that's a great point. I guess in stakeholders, like using that term is like that they have a stake in the outcome. But I think that that's a very interesting thing to consider, and thank you.
Would you suggest a different word to describe people who are going to be impacted by a decision and should be should be at the table?
To
Okay.
best I can guess is community member or, and I haven't really thought about this much or at all. But best I can guess is community member or something like that.
Mhm.
Thank you.
Yeah, I think that that would be an improvement. Thank you. Are there
What-
any other questions?
If anything comes up while I'm going over the resources I put at your table, Neva will remain here for a little bit longer.
Yes, yeah. And feel free to, if we're here after the presentations, if you want to, talk to me on this side, I love to talk about these community health improvement plans and assessments. So thank you for having me.
Thank you, Neva. Am I able to stand here? Well, with the ASL interpreter? Great. So on your table, and I do have a couple, I'm not going to say they're perfectly large print, but they are larger print materials if you need them. After listening to Lindsay's presentation, these are drafts from ASTO, and I want to redo these in a way that is more accessible to all people and making them more engaging. But this is what we have for today, so thank you. The first item is a CHIP checklist for disability inclusion, and I'll go over what that means. And the second resource is a stakeholder mapping template for disability inclusion. So again, the CHA stands for Community Health Assessment, and CHIP is Community Health Improvement Plan. ASTO is a national organization that provides support and technical assistance around local and tribal health departments and state health departments. And I reached out because the CHA and the CHIP, that's not my expertise, but I was encouraged because of my work with the state health improvement plan and the state health assessment, and making sure that we included people with disabilities in that process, and really looking at a strength-based approach with that focused in social determinants of health, which did happen. So I worked with ASTO, and they provided some support in creating these resources so that you can take them back to your communities and use them. And I really told them that we may not have local public health departments at this event. And they said, that's okay. These can be used across programs. So if you are thinking about, I want you to first think about what is a program or activity that you've recently implemented or you're in the middle of planning and implementing. And so hold that in your head. If there's a project that you've recently completed or one that you're in the middle of planning or implementing. Okay. Now that you have that project in your head, the first resource, CHIP Checklist for Disability Inclusion, lists 6 steps on how to be more inclusive of people with disabilities in the process of that planning and implementing for that work that you're doing. And this, like I said, you can use this outside of CHA and CHIP. So the first step is establish a planning team and organize the planning process. And under that are 6 questions to think about while you are establishing a planning team. For example, are representatives of the disability community or people with the lived experience part of the planning team or advisory council? How can community members be compensated and recognized for the value of sharing their lived experience? So are you able to provide honorarium for their participation in your coalition? What does your organization allow? Can you provide a gift card? Sometimes people with disability don't want a check or cash because it can impact their benefits, but gift cards are a way to still provide them with that value and recognizing that their work is valued. Are members of the population, their families, and/or service providers invited to participate in a manner that works for them? Are team members aware of and intentionally using language choices preferred by relevant populations? Are planning materials and meetings easily available, both physically and virtually? We've talked about accessible materials throughout this whole conference and what that looks like. Did you do that in the program that you are planning or implemented? Do you hope to do that moving forward? And then how can this process be revised to better include the voice of people with disabilities? So this is the type of checklist that can help you identify which ones did you check off this time. And sometimes we can get really overwhelmed with the number of check boxes that there are. And so the idea, it's not about just checking a box, but it's really about including the people in the community. So if you checked 3 of these boxes, see if next time you can check 4 or 5. This works all the way through. My ASTO support people said that you should really start with step 1 and 2 and including people with disabilities. And then as you gain more partnerships and budget line for providing honorarium and accessibility supports like ASL interpreters or closed captioning or CART captioning, then you have the power to build out the accessibility for more people to participate. And again, like this checklist it's just a checklist. If you aren't really understanding what needs to happen to include people with disability, that's when you reach out to your Centers for Independent Living to talk to them what needs to be done so that we can communicate with people with disabilities and so on. We've heard all this stuff today, so I don't want to belabor that. The small group discussion, I know we're, I want to give people an opportunity to think about what they've done and then talk about it as a group. So I'll facilitate a couple questions around that. The other resource is the stakeholder mapping for disability inclusion. And that gives a few steps as well. And if you, finding the right partners and really including disability agencies, organizations, service providers, and communities members into your process is so important that there's a separate document that the stakeholder mapping document can support that work. So thinking with your program, are you including, who can you include that supports the voices and are the voices of people with disability? Do they work in the government, coalitions, community service providers, education, healthcare, community members and groups, churches, non-traditional partners? What are the big categories that you're missing? And then you can think of, this says choose your top 4 categories of partners and community members. And there's a table on the second page where you can put those overarching categories. And then underneath it, you can identify specific jobs or specific people that you want to invite to the table. On this, at the bottom of the second page also is a matrix that then allows you to put those community members and organizational leads and program managers into a box based on their power or influence and their interest in the project itself. And these are still drafts. So not only am I open to like supporting the discussion here, but if you have comments about this not being a supportive document, I'm happy to have that conversation with ASTO about how we can improve that. And then the third page, step 4, is to develop a communication plan appropriate for partners and stakeholders or community members based on the results of that matrix. And some of the language in here I think is a little, it feels a little harsh, like saying that people who have high power and high interest might be dominant or forceful in how they're participating. But I think there could be better language to describe that they're passionate and have the time capacity to participate in the work that you're doing. The second level would be someone who has a high level of influence but low interest. So people who really are champions but don't have the time to participate. And it says to keep them satisfied. So we're still learning how to integrate inclusion with the CHA and CHIP in our programming. And so thinking about how we can include you in that process too. Okay, that's a quick overview of these resources that you can use in your programming, specifically CHA CHIP, but really whatever program you want to include people with disabilities within public health. And so I have a couple questions for your small group. Is thinking about, I didn't write this down, so I don't know why I'm fake reading. Thinking about the project that you came up with earlier about what you've recently implemented or not. You can use the checklist to identify ways that maybe you didn't include people with disability, or really anything that you've learned throughout this conference. We can, instead of focusing on these resources, but in the conference the last 2 days, in this summit, what did you learn that you can take away that you will bring back to the work that you do? We'll start there. So if you want to turn to the people at your table and talk about what's one thing that you will bring back to your work or your advisory board, something that you can do to improve inclusion within nutrition and health. Go. Okay. I'm going to walk around, and I would love if one person at each table had something to share, whether it was an overview or of the group, or if just one person wants to share what they learned and took away with the entire group. Would anyone want to?
Ooh. So 2 takeaways. One is that change takes time. And we were able to do a lot of wonderful community-based participatory program development and research in Montana with people with intellectual and developmental disabilities around the nutrition supports they needed and in the settings where they live. And it is so exciting to see some of that work. Kathy Humphreys was a big part of that, Tom Seekins, many of our group home providers and direct service providers in the state, many people with intellectual and developmental disabilities. Jean, you were in Spring Meadow were some of them, and Connie, and many more. In terms of really articulating what are the design principles. If you're going to be doing nutrition supports with people with IDD, what are some of the ways that we can give you some design guidelines that help you make decisions about how to offer the programs? And we were doing that work in the late 90s and into the 2000s. And to see that that work is so important to some of how we're doing some of the cooking classes and the program like Mom's Meals, and saying, okay, where do we need to go next? And affordability is always an issue for all of us. So loved having a conversation with Katie about that. You know, Montana reimburses $6 to $7 per meal, and other states are more like $14 per meal. And just trying to think like, okay, can we invest more in the meals so that they're maybe of a higher quality, and or are there providers locally who could be organizing those meals with community members for a less of a price, and maybe there's more employment opportunities for people with IDD to be helping prepare those meals. It's just such an exciting moment, and bringing together partners like this and thinking about the cooking classes and how that could prepare employees to be a part of a small local business. It's just really exciting. So change takes time. We're at a very new moment, I think, in terms of inclusion. And I think we felt that from the gardening panel as well. There's been lots of work over many years, and it just was so rich to have the panel that we had and the representation of what is needed at a therapeutic level all the way through the settings where people with disabilities live, and just some of the gardening supports that can be provided, and all the rich levels of outcomes that we can expect when we do that work together. So it was great to have Ian here to moderate and be thinking with him about the huge network of food partners that he works with, and that he's taking away some really important messages about accessibility and inclusion. And again, it's just such a great new moment for us. And so just for me, the takeaways at this table were to continue to follow up and learn more about partners like Mom's Meals, to be supporting partners who have really state leadership opportunities, to be taking what we know and bringing it into their networks with more policy and leadership. So
Thank you. Does this table want to share anything?
Well, I'll start with kind of my own. I think historically, when I think about accessibility and inclusion in my work, it was about inclusion of the end user, the person with a disability. And what I appreciated from this summit is taking inclusion to another level and recognizing the overlap sometimes of good intentions around health and nutrition for all groups of people, and how that inclusion also is a message to us to work together and be inclusive in sharing our ideas and our resources and our opportunities. And something shared at our table was also learning what kinds of things are going on that can be directed towards resources that are available to help leverage their efforts and to bring those visions and opportunities to fruition.
Thank you. Does someone at this table want to share? You don't have to. Great.
Jesse, I'm the director of the food nutrition program at Montana State University. And I have just been thinking a lot about I've only been in this role for a year. And so this really got me thinking a lot about where inclusion specifically for folks with IDD is being talked about within our curriculum. I know in the coursework that I teach hasn't been a part of that. And so I've got some exploring to do and figuring out how that integrates. It's also interesting to me, we are an accredited program and this is they're nowhere in our accreditation standards, which is a huge miss. And so that's something that I'm thinking about and talking to the national level. One thing that I just wanted to share is yesterday morning, I had kind of an interesting experience because I was feeling a disconnect in terms of inclusion. So I wanted to share that. Again, this is not my space. My history is before I came into academia, I was a clinical dietitian working in diabetes, eating disorders, disordered eating, and body image concerns. So that's kind of my frame of reference. And so as we were talking yesterday about medical versus social views and how folks with disabilities, we should be approaching this from a social, frame of reference. I also started hearing a lot of talk about like obesity and BMI and managing health from that perspective. And in the work that I do, we're really focusing on taking that away from the individual, acknowledging that that is not an individual responsibility and rather a societal one. And so I guess my challenge to all of you is to maybe consider changing that frame and considering that as part of your inclusive practice.
Thank you.
Are you talking about the approach that you change the setting that the person lives in instead of trying to get the person to take the blame for the fact that they're overweight or something? Is that what you're like the PSE approach?
I think what we need to recognize is that very little of one's body size is within their control. And so by focusing only on individual behaviors, we're actually missing the big picture in which body size for most folks is not changeable, or it can be in the short term, but not the long term. And so we need to be thinking more higher level about people's access to food, genetics, where they live, work, play, rather than individual change. Yeah, and I think that the lunch speaker kind of did an interesting thing just talking about like as we're talking about nutrition, thinking about the experience around food, whether rather than specific nutrients and that sort of thing, which I think is a step kind of in that direction, rather than like as an individual, this is what you need to do to change your body, which is not actually changeable for the majority of folks, at least in the long term.
Thank you for sharing that. Anyone at this table want to share what they took away?
Thank you for that, by the way. I appreciate the comment. We talked a lot about just remembering to include varied populations, including IDD. I was thinking about, I oversee a Alzheimer's dementia grant and just making sure that I'm really including folks that are really affected by that. And I think it's just a good reminder for all of us to remember to keep those that idea and those conversations and those individuals at the forefront of our mind and making sure that they do have several seats at the table, as it all should be. Did I miss anything?
Thanks, Kyla. Anyone at this table?
Um, I'm Diana from Summit. I am a middle-aged white woman with blonde hair. And most everybody at our table was in agreement with Lindsay's presentation and ideas about inclusivity in printed materials. We all agree that we're going to take that back. I'm going to be sitting there going through all these handouts from our agency or that I use in Kalispell and really changing those up, thinking about that and thinking about plain language and how to kind of make things more, what was your word? Jazzy. Yeah, I'm gonna be jazzing it up. And so as far as inclusivity goes, it's kind of, we at Summit, that's what we preach is about inclusivity. And so I will just say that it was I enjoyed every moment and being in these rooms, and I'm sad that we had dueling breakout sessions. But I'll get back to that, and I think everybody will watch those that they missed. And did I miss anything? I think that was it for our group.
Thank you. Anyone at this table? Was that a?
Right, okay. So at our table, we had an interesting discussion around how certain activities are not accessible to everybody. So like, for example, camping. I know this is really like off topic, but this man really likes camping. And he works with individuals that have disabilities and he takes them camping. And they love to camp, but he said that he ends up doing most of the activities. So because the materials are not accessible. So we were saying like that's a really like interesting little thing that maybe is passion of his to like how can you make certain activities more inclusive that are not, and camping is one of those examples. So like maybe he partners with like REI to like create some materials that are accessible to individuals with disabilities to like put up a tent in a different way or like cook over a fire in a different way. So that was like kind of a interesting way to take this conversation, but it's also shows that like thinking outside of the box on like something very specific could have a really big impact for individuals. And then that's also like therapeutic. And it's another funding opportunity really, if you think about like outdoor sports or like maybe they're not really in this space the way that they could be. So we talked about that. Yeah, I know. It's so awesome. Yeah.
All right, so the few of you around here all know that we do a men's group. We have accessible fly fishing out at Camp Bullwheel and Annis. We do accessible disability hunts, you name it. But one of the things with my men's group is we've done all that, but when I've got guys in wheelchairs or guys, whatever disabilities, behavioral, whatever. A lot of the times because I take them out to teach them foraging skills, survival skills, camping, how to cook, you name it. And a lot of the times, like she was saying, I do end up doing all the work because like putting a rain fly over a tent, yeah, they have the tents that you just throw out there and they pop open, but someone in a wheelchair, that can't really move very well, can't put the stakes in, can't put the fly tarp. By the way, there's going to be waivers that everyone needs to sign at the end of this before you walk out saying that you're not going to steal my idea. My lawyer's on speaker, so I'm just kidding. So yeah, that's pretty much what we were talking about, but she's better at talking than I am, so. But I mean, when you're camping, you got to think, like when you're foraging, like rose hips, berries, stuff like that, some people can't reach up into those bushes or even get to those bushes, I mean, I have a track chair the VA got me when I used to not be able to walk. And, I loan that out to people, but it's just one track chair. One of the guys has a power chair, but there's a little bar that sticks out on the bottom that hooks into his van, when he has it pulled in there so it doesn't move around. And that just digs into the dirt. So, I mean, I don't know. Yeah.
Yeah.
Well, yeah, and yeah, exactly. And learning how to eat outdoors, how to forage, certain whatever. I mean, I teach them a lot of different things, what not to eat, what they can eat. Some of them try to eat stuff they're not supposed to eat, but just, yeah, right. So But anyways, Meg knows.
Thank you. And Kelly wants to share.
One thing maybe they could do outside if they want to is ride horses. Like me, I have a horse. I love doing it. And I exercise, and the horses can exercise. Maybe they could do that. Would be fun for them. But I don't know. Maybe they don't want to. Maybe they think it's gonna be too dangerous. But they could maybe do that for an activity.
Thank you. And thank you all. Chester, I know you just got here. Did you want to add anything?
The way that my mind's thinking right now, I'd say move into you propose an idea. I'm going to give my opinion on that.
Are you talking about Charles over there? Oh, well, how about we talk about it after?
Yeah, of course, my meds just kicked in, so.
We'll talk about it after the end of the conference. Thank you, Chester. So that wraps up the last part of the conference, and we have our closeout now. We do want to provide an evaluation. I've been working on it over the last 2 days, and I decided that in response to everything we've done, I want to build it with my planning committee. So you will not get an evaluation today. We will send one out in email and ask you to fill it out, and we'll have questions that reflects what you've seen this week as well as what our disability advisors think would be good questions to add. So with that, I'm going to pass it to Meg and Damien.
Okay, thank you for everybody and all you contributed today by being here, by preparing presentations, by all your work that you do every day and bringing that knowledge into this space. We really appreciate that. Again, just to remind folks, or maybe just clarify for folks, Damien and I were invited to Washington, D.C. as the Montana delegate on inclusive nutrition and to be a part of a scope of work that Special Olympics International has with CDC to be building out inclusive health. And we were invited last year to D.C. with Mary Pittaway. Also, there was a Blackfeet delegation invited, and we were all asked to do a SMART objective. And Damien said, let's maybe do a summit here on the University of Montana campus and build capacity here to be leading on inclusive health. And I was excited. I said, yes, let's do that. So here we are today. And we understand that Special Olympics has 5 years for this work, and we hoped to keep you guys engaged. So again, we were very open to your feedback on things we can be doing in the future, hopefully to fulfill the scope of work the Special Olympics International has funding for 5 years. So we are committed to making the recordings and materials from the summit available for folks who couldn't attend or for you to review sessions you couldn't take part in, and making those materials available in accessible formats. That takes time, so please give us grace and patience as we work through our post-production steps and get those materials available for you. I want to remind folks that our pharmacy team is available by the registration desk. There is a private area where you can have conversations about vaccinations or maybe medications. And also they have the COVID and flu shots on and available. And the students, they really do want to hear from people with disabilities and people who work with people with disabilities about how to better train our students to be more inclusive in our practices. With that, I'm just going to turn it over to Damien for our closing remarks.
I did get my flu and COVID shot, so go get them. And on their form, it does ask, do you have a disability, yes or no? And then it asks, it has some different categories that you can choose from. So I feel like, I'm not an expert, I feel like that met the spirit of what was presented. But they're also, like Meg said, happy to receive feedback. So when it comes to the summit, Meg was right. So we were in Washington, D.C., and they said, well, if we're going to give you money, you have to do something. And I'm like, I hate that. Why, why can't you just give me money? Nobody does that. If you think of an idea like a spark, what I love to do is light a match, drop it in a pile of wood, and say, okay, somebody control it. That was our planning committee. So if you were on the planning committee, will you please stand up? Oh, yeah, sorry, raise your hand. Yes, yes. Sorry, again, inclusive language. Let yourself be known so that we can appreciate you. So thank you, everybody who was on the planning committee. And this ideally will just get bigger and better with each year. So we look forward to seeing you all next year. And on that note, Mary, did you have something?
So we found an extra box of the kitchen supplies and equipment. And there's a few of you left here. We want to make sure everybody has a chance to take at least one thing home, if not two. And think, how could, have this thought in your mind when you're using it. We need to make all situations as inclusive as possible for people who don't fit the mold. And so we're giving it to you as a gift and a thank you, and hope you'll use that to spur your ideas on the sparks that Damien was talking about. One more thing I'd like to mention, Chris from findhelp.org had to leave early, but he wanted to ask you to consider, he's happy to put together a Zoom call where he could share information with this group and do a demo on if your organization, not the big world, but if your organization would like to become fluent in using findhelp.org, he's going to give a demo and it'll be Montana specific. So when we send out the invitation, we'll put an invitation to that too. If you're interested, you can respond. So we're not going to do mass to everybody, but those of you that are interested, we'd like your input and the opportunity to learn more about it from the micro level, because he was talking about it mostly from the organizational level. So thanks for all your ideas, everybody. It was great to get to know so many more people.
So two more quick closing comments, but it looks like we have a hand raised over here, real quick.
That's for what you said, Oda. Did you say that there was a disability question on the vaccination thing, or was that something else?
Was that?
Thanks for that question. So the University of Montana has funding from US Aging to be a part of promoting vaccinations with people with disabilities and older adults. And through that effort, we are collecting data on who is getting vaccinated. That is different than what is required currently in vaccination services. So we are able to say whether or not people with disabilities are getting vaccinated. And those public health data are not really available except through a couple sources. And you have to really dig to understand whether or not people with disabilities have equal access to healthcare and equal access to vaccinations. Okay, we'll get you that page. Great, thank you.
So good reminder, if you didn't get your vaccines yet, please do that. The students are still out there. And then the last thing is that just as a reminder, at 2:30 in front of the registration desk, if you gather there, there will be a tour of the UM Ethnobotany Garden. It is not entirely on the other side of campus, but it's a little bit of a distance. So please plan for that. If you're not from Montana and this weather happens to be very cold for you, please make sure you have a jacket. The garden is outside. And so at 2:30 in front of the registration desk, that tour will start. We really look forward to seeing you all next year, and thank you so much for being here with us. And a final round of applause for our interpreters and our captionists.